Health Minister Joe Phaahla says children with weak immune systems between the ages of 5 and 11 will be eligible for Covid-19 vaccination next year. Those are children with chronic respiratory problems as well as heart and neurological problems. They'll receive a paediatric Pfizer vaccine from February of next year. Let's talk about this now with Dr Lesley Bamford, specialist at the National Department of Health. A very good afternoon to you, Doctor. Grateful for your time. I've touched on slightly the issue of which children would now be able to get this vaccine, but why is it important that they absolutely get it now? Because for the longest time there were question marks about whether kids needed COVID vaccination or not.
So good afternoon and good afternoon to the viewers. So yes, what you said in the intro is certainly correct. Until now we have not offered the COVID vaccination to younger children. As you know, in our adolescents, children from 12 years upwards have been eligible for vaccination since last year. So I think the reason we haven't vaccinated children, younger children, initially we had less data. We had to wait for data so that we could be completely sure that the vaccines are safe to use in children. We know now that they are safe, they are effective, and they have been registered with SAHPRA.
What then about
people? Of course, we
people?
also know that COVID is a much less severe disease in general in younger children, and that's why we're not targeting all children in the general population. But there is a subset of children who, if they develop COVID, can develop severe disease. And so from next year, we will be offering vaccination to that subset of children.
And for those children who are immuno-compromised, how many of them are presenting with more serious symptoms, especially in the 2 years since our first lockdown?
So we know that currently we have a low number of cases of COVID in general across the country. But even during the waves, we know that it was much fewer children were affected with COVID when compared with adults. And as I say, in the vast majority of cases, younger children had mild COVID. But we certainly have seen children admitted to our hospitals, to our ICUs. We have had a small number of deaths amongst young children, predominantly children with some of these conditions that we are now targeting for vaccination.
What say you then, Doctor, to parents whose children may have these conditions but say, well, my child has fared fairly well since 2020, and even when they were infected, they survived with little or to no problems at all. Is it absolutely necessary to then take the jab?
So, let's be very clear. We've learned a lot about vaccines and about immunity over the course of the pandemic. But one thing has remained unchanged, that vaccination has protected people from developing severe COVID, from requiring hospitalization, dying from COVID, and has protected people from developing long COVID. And the same is true for children. We only offer this vaccine when we know that the benefits of receiving the vaccine clearly outweigh any risks associated with the vaccine. Mm-hmm. So we would really urge parents of children who are eligible to be vaccinated for them to come forward and be vaccinated. It will protect them. It will protect them against developing COVID, requiring hospitalization, and severe disease associated with COVID.
And I know the sweet spot I was reading is around 21 days for the second dose for these children who will now be covered from February next year. What about the 21 days makes it the perfect spot to then get a second shot?
So we will be offering the Pfizer vaccine. That is the vaccine that is registered for children. And the period between the first and the second doses of the Pfizer vaccine, the recommended period is 21 days. That is the same for adults. At one stage, we did extend the period, but that was in the very early days of vaccination, when there were constraints on supply. And we therefore pushed the period out so that more people could get their first dose. However, once we had good supplies of the vaccine in the country, we went back to the 21 days. That is the period that was used in all the clinical trials, which showed the vaccine to be effective and safe. And for that reason, we regard that as the optimal period between the two doses.
Just lastly, Dr. Bamford, let's talk about side effects in children. How severe or serious are they? Because when we all first got the shot, many of us got to experience the tiredness, the chills, but we were all told at the time that, of course, you'd be fine after a day or two.
So children may also experience side effects, probably slightly fewer than adults, but we know that many vaccines are associated with minor side effects, fever, chills, some soreness at the site of the injection. These side effects are relatively common, but we know that they resolve within 24 to 48 hours. And the same is certainly true for children.
Dr. Lesley Bamford, good to speak to you from the National Health Department.